Hi, welcome to Because Looking Good Feels Good with me, Dr. Janet Allenby. Today we are going to have an absolutely gorgeous, beautiful plastic surgeon, and she's a plastic and reconstructive surgeon, and she is going to give us some inside scoops on when is it time to go past the needle and get into her office. So welcome to my house, and I know we are in, actually she's coming to join us, so let me get her on here and she should be joining us. So, okay, so Dr. Yee is a plastic and reconstructive surgeon. Hey! Oh, look at how gorgeous you are. How
Hi!
are you? Good to see you.
So excited to be with you.
How you doing in this lockdown phase?
I'm actually doing great.
I know. I know. I need like another week because I'm about to finish all my cleaning jobs and I'm about like 1 week away from finishing up everything.
It's funny. So a lot of people don't know this, but I'm like a true introvert. And so, yeah, right. And I just love my time at home. And my poor husband is the opposite. And he's just like crawling out of his skin. So I'm kind of like always, hey, do you need me to hang out with you?
You're like, do you need me to hang out with you? You're like, I like my space. Actually, you know what? Being single and I got this one. Actually, other than us two, and I see my mom, I really, obviously I have no contact with anybody, and I'm kind of getting into the groove. I hate to say it, but it's kind of
Yeah.
nice.
It's going to be really weird starting to see people and then keeping in mind that we have to social distance, right? I mean, you want to give someone you haven't seen in a long time a big hug, but you just can't.
It's weird, like, walking her and I see people in my neighborhood who I know, and all of a sudden it's like, oh my gosh, I can't, like, come and give the hug. And it is weird. Now, I got to tell everybody about you, first of all. Okay, everybody who's looking at you right now, they're like, oh my God, she's a plastic surgeon. First of all, surgeon, plastic surgeon. That's like not an easy route to take, honestly. It is a man's world out there. Whoever doesn't want to say that that's true, it is a man's world. And you got to have some, I'm not going to say anything inappropriate on Instagram, but you got to have a lot of, I think of you as a spitfire in our community. And, one of the cool things about you, and I'm going to brag about you because, we can never do it to ourselves anyway, especially an introvert like you. Like when I see you, and Dr. Yee is a national, international lecturer. She is, when you have to go to one of the events that is going to tell you about the new and upcoming, she's the one on the podium. She's the one giving all the lectures. And it's amazing. Her technique is amazing, but you can't be a spitfire without having the knowledge and the experience and actually the results that you get. And I think that's what people need to understand is on this program, because Looking Good Feels Good is only for people. I only have on people that are cream of the crop, and you are
Aw.
to me and to all my colleagues. I mean, we all love you because you're very honest and you deliver results, and that's not always the same in our world. There are people, what we call them hired guns, and you pay them a couple bucks and they'll say anything about anything, and you're not one of them. If you don't like it, I know you're just going to be like, that stinks, I don't do that.
Or I'll say nothing and walk away.
Yeah, well, you can be polite. I tend to, yeah, you're good on both directions on that one. But I mean, that's why I think that's so good about you is you're really honest, and but more importantly to everybody who's out there, not only are you a plastic surgeon, reconstruction, you do body, you do face, but you also do a lot of what I do, which is the injections. And I think that is like an awesome combination. Now, for everybody who has never, don't know Dr. Yee, she is down in South Miami, and she's kind of like got the market cornered down there because she's amazing. And anybody who I know, if they're like, oh, do you know anybody down there? She's the one. It's like, she's the one you need to.
Aw.
No, because they're not going to drive from South Miami to come see me in Boca,
Right.
and the same back and forth. I don't want them. I would rather them just stay down there, do the stuff with her, because I know they're going to get a good result. And that's usually probably my worry is they go somewhere and they're like,
No.
I'm going to have to fix them afterwards. What am I going to do?
Yeah.
So how is now you got into working out really big when I talked to you last at our last meeting. How's that going now with all this? Can't go anywhere stuff.
Okay, so first I got to tell the funny story why you and I talk about working out. Do you remember that?
I know what you're gonna say.
So, so Janet is a total girl's girl. Like we were at a meeting. I just looked back at my phone. This was like 6 years ago. This is back what I was 44, right?
Uh-huh.
So I wasn't exercising at all. I was one of these like very fortunate thin women that could kind of fake it, skinny fit, right, or skinny fat.
Yeah.
And I was having like a moment where I was having somebody take a picture of my butt next to Charles Boyd, who is a facial plastic surgeon. And Janet looks at me and goes, "Hey, Jackie, you need to start working out."
Okay, you can shoot me. I'm a jerk.
But like, I love that because who else is going to tell me, hey, you're prancing around with this big old flat butt? And so I started. I really did. I mean, it took a while, and
It
that's funny
does.
because it's really hard. I was never active as a child. I was always reading a book, or I was very sedentary, as I still want to be, but I can't. And so it took me a while. I've had 5 trainers. And each time I like something about one and miss something about the other one. And I've got a full gym in my house. So
Nice.
now what I'm doing, I actually got hurt at the end of last year. I overdid some squatting before we were supposed to go to a meeting in Cancun. So I've been kind of out of and so what I've been doing is I've just been keeping sane by staying on the treadmill. And so I'm doing 3 miles a day, which probably isn't a lot for a lot of people, but coming from someone who's so sedentary, it's a big deal for me.
Uh-huh.
And so what I do is I force myself to either watch YouTube videos or read or watch Netflix so that when I'm on the treadmill, I'm not,
Go
hating it.
crazy? Right.
But I can't go too fast because then I'm always worried I'm going to trip and break my iPad. So I'm a combination of walking and jogging, and that's about it.
I love that. I love that. Actually, I will tell everybody out there. Last time I saw your body, you were looking very hot. So you're doing, and it does take a long time to see the results. But it
Yeah.
really, I mean, it has, I was like, oh my God, you look so amazing. And you're like, yeah, it's your fault. I'm like,
Yeah.
oh, wow.
Because you remembered how gross I was.
You were never gross. Like everybody, she was never ever gross. She was like stunning, and I apologize. I am extremely like inappropriate
No,
sometimes.
I like when you said it like that, I was like, okay, I guess I got to start working out. So I like ever since then, you've been my girl, man.
Well, please tell me whatever I can do, and it won't hurt my feelings. And I do. That is like one of my things with, and I actually have, as we get older, you have less best friends. And I actually, my best friend, she'll tell me, like, if she's like, oh my God, the cellulite is getting bad, you got to do something. It's like, what? Because you kind of don't look back there too often.
No.
Right. You don't know what's happening until someone, turns the light on for you like this. So, okay. So anyway, we got to talk some fun stuff for people to hear other than our
Okay.
gossip, which is, I think our gossip is fun actually. But anyway, so talk to me. Now you are doing everything basically that I do, but then you're doing body. So real quick into the body stuff, which I think is, that's one of the big hot topics I keep hearing about in my office, is that a lot of people are getting their implants removed, their breasts. And I know you're a big, breast augmentation or reducer or reconstruction girl. So talk to us about what's going on there.
Yeah, so I think there's multiple reasons why people are choosing to explant their current implants. I think that a lot of people, that was a little bit older school to have like really, really big breasts. And here in Miami, we have a lot of that still going on. And I think what everyone's fear with that is that they have to end up doing a lift or putting some incisions on their breasts. But that's one main reason is I think that we're kind of getting away from the overly large breast.
Uber boobs.
Yeah. And also, I think that as we get older, our bodies change, right? I mean, we can dress totally different in our 20s than we can in our 30s and our 40s. And there comes a point where you're trying to wear something businesslike and it just looks a little hoochie mama if it's a little too clingy to your body. So I think that's another factor. And menopause changes, people's breasts change with time. They get bigger, we get a little wider, we get a little bit thicker, and it just doesn't look as good. But then I think there are also people people who have, breast implant illness, people that don't feel well. And despite the fact that all the studies, we can't really figure out what's going on, there are people who feel better when we get their implants out. And I mean, it's interesting because a lot of people, we don't know why they feel better. We don't know why they feel bad, but I've had several patients that afterwards just, maybe it's the weight, maybe it's the thought, but they definitely feel better. But that doesn't mean that there's still not a lot of people getting augmented. There really are. I would say that now in my career, I'm seeing the smallest sizes requested.
Really?
Like I have multiple people, and I'm in Miami, and people
and
are still
a long time, so it's not like you're fresh off
this is going to be my 19th year in practice.
Wow.
Yeah, it's
and
crazy.
See, you still look like you're 25.
Yeah, I started at 6.
Exactly. I was an embryo when I started injecting.
But with breast, I'm also seeing a lot of reductions. A lot of people in menopause or postmenopausal, they're going for reductions too. It's very cool. But back to the whole small implant thing, I've had multiple, and even young 23-year-old girls. What's the smallest implant, and what will that look like on me? And it's pretty cool because I think a lot of them care what they look like in their pictures. I think Instagram and all our social media, I think they're starting to see a lot of that. It's pretty interesting.
Yeah. Do you think that, one of the things I kind of notice when people have those huge implants is that they tend to look, I got a little, okay. They look heavier. And I think that the camera does make them look heavier, even if they, have a teeny little waist, if they don't have the proper photograph situation. And I actually, this was interesting. I had a real self discussion, and I was talking to Tom Siri, who, and he was saying something about image health. And now that everybody's on this camera thing, image health is like a whole nother avenue of how we look. And I think it's saying to what you're talking about is, the way that we are photographing may look bigger because these, monsters.
And it's interesting. We're getting away from like just pure still pictures, right? We can always pose and we can pick, but with like these kind of calls and Zoom, when we're moving, you really get to, the animation makes a huge difference. Definitely. And for sure. So someone may look great in a pose, but if their lips aren't moving normal or their face isn't animating normal, people look really freaky.
There was a question that just went by that is pertinent to this. Are you seeing a change in under the muscle or over the muscle implant today?
Yeah, so I think that, for me in my practice, I pretty much stay under the muscle unless somebody has been on top of the muscle. I think the main reasons for people converting from under the muscle to on top is they're worried about animation or dynamic movement of the breast. So when they're using their shoulders or they're using their chest, they'll see that implant kind of shift. So that's one of the main reasons. So most bodybuilders will get their implants on top of the muscle. Wow. Now, some of the downside of on top of the muscle, though, is unless somebody has adequate breast tissue to begin with or has a thicker layer of subcutaneous fat, they can sometimes have more problems with rippling or knuckling, where you see like the edge of the implant. So it just depends person to person. Like if somebody was really, really thin with very minimal breast tissue, I'd probably urge them down the road of under the muscle, or they'll have to kind of take fat from somewhere else and coat the breast. But if they're really thin, they oftentimes don't have extra fat to put.
Right.
So
which is all a self-worth.
Exactly.
I'm this big.
Yeah, it's crazy. Yeah,
it is. And, we're all in this field down here. And it is like when my PA joined me, and she was from New York, Christina, and she was like, everybody here looks amazing and they look, so good. And she was like, I gotta get busy. And she's been with us since January, and she's already transforming. She's transforming into one of us. So she's like, oh great, here
I think it's got to do, with the weather. We're always kind of exposed. If you think about when you go to somewhere where there's seasons, right? That these people can wear a sweater, they can wear a jacket, they can wear scarves, they can hide a lot of stuff, but we're pretty much always like, I wear flip-flops every day. I have gone obviously now days barefoot, but I wear flip-flops. I don't wear jackets, so you can't hide it as much.
Yeah.
And there's so much more skin exposed here in Florida.
You know what? Actually, I am going to diverge just a little because you were talking a little bit about things people don't really talk about. And are you doing anything with, because we're both in our, you are just turning 50, I've been here for a while, but are people, is there a lot of like downstairs stuff being done, I'm going to say? Are you
Yes.
doing a lot of that in your office?
So I don't do a lot of it. You know, I would say, I mean, I'm going to assume you have some of those wonderful lasers for downstairs.
Yeah, yes, yes,
Yeah.
yes.
I think that the lasers have opened up the conversation
Mhm.
for us as surgeons. So I don't have any of those lasers for like Mona Lisa or
Right,
Thermiva.
right.
But a lot of patients, because they're aware of this all, I think they are kind of looking down there a little bit more often.
Yeah,
I've kind of always had a rule of thumb that I'll do it on a patient if I'm doing surgery on them anyway. It's not
yeah,
usually a common area for me to go just to go.
right.
But interestingly, I have done that procedure on multiple people in my staff.
Really?
Yeah, and can you imagine how embarrassing that was for them to
I
bring it
know,
up?
I know.
But
I think
me
my staff
being,
has seen everything about me.
but
Like,
you know, being a female plastic surgeon, it's just a little bit more comfortable for them, you know. So I'm seeing more of it for sure. But I do usually refer to my gynecologist who does have some of those lasers and
right,
devices.
right, right. We use the Thermiva, and I will tell you, huge, huge popular device. Not just for
Yeah.
the women, but the partner. The men like are calling us like this was the best procedure my wife ever had. We're like, oh, too much information. But it is, I mean, you being a female, I think, is just such an advantage, and I really kind of think we need to be, and we, you and I maybe, but we really should be the leaders because you know we kind of know the needs because we're having the problems, you know.
Yeah.
50s is a tough time. It's like you kind of still look good, but things are starting to fall apart.
Yeah.
You
Like our skin, my skin
yeah.
on my arms. What is happening?
I know. Oh, here, this is what you need. I don't know if you guys use this, but I drink Skin Aid. I got to tell you, this
And does
stuff.
it do?
Oh, this one is amazing. It promotes collagen growth, but it makes your fibroblasts start making collagen. It has like marine collagen. This thing I am addicted to. I've been doing it for about a year, and they have a cellulite one, which you don't have cellulite. I know, I've seen your body. But they are actually very, very good. This is a nice one to have in the office because it's almost like a pharmaceutical, you know, kind of got under that cosmeceutical,
Yeah.
whatever legislation. It's not FDA approved sort of thing. Because once you go into that land, then you're like looking at huge expenses.
Yeah.
This one actually has been quite a nice, like helps the turgor, makes you look softer in the places that you tend to see it the most, which is
How does it taste?
oh, you know what? This one's pretty good. It's kind of a mango flavored, and you kind of get addicted to it. Yeah,
Hmm.
the Slay one, they had to reformulate the taste on that one. It was like before, you know, I was like, okay, I'm doing this for a cause.
Because, you know, I've tried those collagen peptides and I just felt like I was drinking bone broth without flavor.
No,
Like,
I
I
know,
just
no.
couldn't do it.
No, no, no. This one actually, it's really tasty, and I have patients who are like, you know, we give them shots of it, and they're like, oh, this isn't so bad. So this one actually has been like a home run for us. It
I'll have to
definitely,
try it.
the patients who go on it, they don't go off of it, and they're pretty loyal to it. Which you know, they only will be loyal to something that produces. You know,
Yeah.
Florida. You
Yeah.
know, that's how we live. Now, you're very often like one of the people that the companies will go to when they're looking at presenting something to the community, you know, or to the world, basically. Like I said, Jackie is on the podium, whether it's to other doctors, but also to patients. Is there anything you're really excited about in more of our injectable world? Because I know you do a ton of that.
Yeah, so you know, this week we're going to be starting to train all the Galderma trainers on Restylane Kiss.
I'm gonna be there with you. I
Oh,
know. I
cool!
know.
Yeah, yeah.
And we're
So
all about lips. Yes.
my last my last flight, the last trip that I took, believe it or not, was to go film footage using Restylane Kiss and doing a demonstration. So that's what we're going to be unveiling on Thursday.
Yeah, I'm gonna be there. I'll
Yeah.
be at your like audience. So see, you guys, I'm bringing you the best of the best here.
Yeah,
Now,
it's
can you speak on it at all right now, or is it kind of off limits still? It probably is off limits actually.
yeah. I can just say that I really enjoyed using it, and I've used it several times. First time was up in Canada, and then in Norway, and somewhere else that I can't say. But it's really cool to have products that are developed for a particular purpose. This is designed for us to pick up anytime we have someone who needs something going on with their lips. So that I was really, really excited about. I'm ecstatic. I'm very fortunate. I'm one of those people that I put stuff in my lips and it stays for a long time.
Oh, you
So I know it's really weird. It took a while. I mean, my lips,
build up to it.
Yeah. And I would say like it's maybe once every 9 to 10 months. And even then when I'm doing it, it's like 0.3. It's really weird.
Nice.
I think my whatever has stuck.
Yeah. I do think it builds up on us.
And it'd be interesting though, if I injected hyaluronidase, what would happen? I wonder if my lips would go back to what they were like, before. Kind of might have to try that.
Yeah, no, I don't know. Don't do that. No. Don't do that one. I've actually always been known for your lips, actually, in the community. She's always got gorgeous lips, gorgeous lipstick. Like, you pull off red like nobody I've ever seen.
I almost wore red today.
I know, that's like your signature. Where is it?
I know, I may have to on Thursday, right?
Yeah. Oh, you should. You definitely should.
But I'll tell you, today was the first day I put mascara on in 5 weeks. 5 weeks.
It kind of feels good to kind of get dressed up again, right? Like you kind of feel like you're part of the community again a little.
Yeah. But you know what's so weird is like, usually I can go, I put my makeup on at 6 a.m. before surgery and I wear it all night. I go to dinner. Right. Now it's like bothering my skin.
I know. It's like,
does that mean like we're going to have to start working up to wearing makeup again?
Well, I don't know about you, but when we open, we're going to be seeing very few people and we're going to be covered. So I still think I'm going to be lesser than more.
Yeah.
Have you been thinking about how you're going to reopen?
Yeah. So actually every Monday I've been having staff meetings with my office. Mm-hmm. And every time we're trying to think about what things we can do to keep ourselves safe, to keep my staff safe and my patients. And the reality is we're just going to have to be a lot more regimented with appointment times. We're going to have to really just limit the amount of contact that we're having with each other. And as much as I don't want to do telemedicine, I think that for the common questions that I get asked, how long does this last? What product do you use? Mm-hmm. I think that we're going to have to kind of do a lot of that before the appointments. And then I just, I'm going to wear a face shield, which I really don't want to, but I have to. And wearing a mask, I've been researching custom photos on your mask so it can be like our own face.
Love it.
Right?
That
or
would be so cool.
You can have your dog's nose. So what I fully intend to do is wear my...
Have fun with it. Oh, that's so you.
I probably will wear my N95 first and then wear, something so it's just not so terrifying. It's so scary. It's so contagion.
It is interesting. And it's kind of like, I'm a little bit like, I see these people doing, like in Fort Lauderdale yesterday, they had a march to open. And I want to open just as much as everybody else, as do you. Right. But it's also like, they're like, oh, we're not social distancing. We're totally, disregarding every bit of science. It's like, okay, I understand we all want to get back. But you know what? It seems so much more credible if you say, hey, I'm going to do this, but I'm going to social distance and I'm going to do every protocol I can to make it safe. That makes a little bit more moderation sense.
Yeah. I mean, I think that people are getting a little fed up with the quarantine and, I think that people are now less scared of it, even though they shouldn't be. I mean,
right. You don't know.
Yeah, we just don't know. And so for me, it's like on one hand, I'm kind of like, well, maybe I'll open up on the 15th. And then the next hand, I'm like, maybe it'll be the 18th. Because I hate to say this, but I kind of want to see how other people who are opening up early, what are some of the hurdles that they're encountering, Right. Like are we able, like I already have my staff buying hand sanitizer so we can have hand sanitizer stations everywhere, but I'm not so sure we're going to be able to get enough of that. And
yeah.
you know, another thing that I've talked to my staff about today is sending out emails to all the patients when we are open. Like, it's going to be different, and it has to be different to stay healthy, right? Yeah. And so, you know, as much as I love to communicate and find out and catch up on everything, it's kind of like, let's get in, do what we need to do, and get out.
I love you, but not, yeah.
You know, and you know, I love the chit chat, but it's not
better
good.
Like this. It's a nice, it's a better venue, and we don't have to dress up always for it.
Exactly. Just the top half.
Exactly. You don't know what's going on down below there. It's like the grunge is happening.
But I think that as long as our patients know that we're being careful for them, I mean, for me too.
Right.
But
it's for everybody.
And you know, I would be so sad if people just came out and then there's this huge resurgence of infection and
you got to go back down the hole again for another month.
I think that will just, I think people will just lose it, you know?
No, it would. That's kind of what scares me. Some of these cuckoos out there just like, yeah, we're going to just like go right to, you know, back to normal. It's never going to be normal again. It's not. It's all changed.
Yeah.
You know, like after 9/11, you can't go through the airport without going through TSA now. It's just part of the game now. You got to play the game if you want to be in the game. You know, you got to be part of it. No,
and it's gonna be interesting. Like, I wonder what sitting at a bar is gonna be like.
Wow.
I mean, are you gonna really sit 6 feet away from somebody? Is that even worth going and doing?
It might be like, no, I'm social distancing. Get away from me.
You can come here.
I think you can come in the social distance area.
Right? I mean, that's just going to be so weird.
It is. It's going to be it is going to be really interesting to see how this whole thing pans out. It really is. And, you know, we were kind of trying to open early, like in the May 4th was our target day. I kind of have a feeling it's not going to work out. So, you know, until we hear something from the governor, at least politically, we have to go by their rules. And then on top of it, you know, I do just like you, I'm making sure that we have the mask, we have the face shield, I'm getting shoe covers. I'm like, you know, everything I can think of to possibly keep the contagiousness of this down. But it is kind of like, okay, what am I missing? Because it's the thing you're missing that's going to be the issue.
Right.
You know, that's the word. It's like, whoever thought we were going to be holed up for a month and a half in our houses, you know, it's the unknown is the thing that we need to be the most concerned over.
Yeah, it's like, I don't want to be caught without something and go, why didn't I think of that?
Right, exactly. And you guys out there, we're all kind of trying to band together and figure this out together, because it is everybody's issue. It's not just Jackie and my issue. It's every practice is trying to figure out how to do this the best for their patients and to be the best that we can be for our patients in their safety as much as what we do for their cosmetic outcomes.
Yeah. Yeah.
Now, I am going to ask you, because we're kind of probably going to end up losing too many people because we're just chit-chatting. I love it. I love this anyway. Okay, I normally ask something else, but I kind of want to ask something different based on the Brad Pitt Fauci thing. If you were going to be played as an actor, what actress or actor would you have play you if you were going to be on the Jackie E's life?
Oh, I got to choose anybody?
Anybody, of course.
Okay, I would choose somebody totally hot like Chris Hemsworth.
No, for you. No, not
I know. No, for me, because everyone would watch me. Because he's so hot.
You are so funny. Okay, not totally like that. You know what? I was expecting to be surprised, but like normal, you like totally took it off the whole other level.
Could you imagine it with my red lips? He would look so good.
You should like cross it over. We could do like a meme of you like that. And with the bodybuilding now, you totally would rock it. Oh, that would be so good. I love that. I know, I was thinking about that, and I'm like, I don't even know who I would have. You know, Fauci just popped out with the Brad Pitt thing, and I'm like, that was a pretty cute little stunt they did.
Yeah. Let me think of a girl. Like, I mean, obvious ones would be anybody Asian, right?
Yeah,
I mean, if they're going to play me.
I know. You could be anybody.
I guess maybe I would choose Lucy Liu. I mean, I would love to look like Angelina, but I think Lucy
I
Liu.
think Angelina, you could do Angelina, and you could like rock it.
Let's do it.
I know, and I can totally see that the cheekbones. Yeah, rocking it. I love it. Anyway, thank you so much for joining us.
You're
You're
welcome.
amazing, and enjoy your treadmills and your working out. And if I open early, I will let you know what's going on. If I can get open, I will. If I can't, I'm going to be hanging out at home like you.
Yeah, which I'm happy to do.
I know, right? I thank you. Bye,
Bye.
Jackie. So, okay, she is such a hoot. We love Jackie. She is always like turning like sometimes our boring meetings into fantastic fun, as you can see why. Quick, what's going on? As you heard, I am trying to get open. I don't know if it's going to happen. We are trying very hard, but you know, it really depends on what the situation is, and we don't want to put anybody at risk. That's our biggest issue, is making sure you stay healthy, we stay healthy. We are still doing our $1,000 Elastin giveaway, the products. Speaking of which, Skin Aid was also on special. This was 10% off. And everything's free shipping, but the $1,000 Elastin giveaway is a really nice one. And the parameters are on Instagram. We'll post them again for you, but you can always direct message us. We are still doing virtual live consults with Christina, and she is like banging it out there. And other good things going on. We actually, as we start getting ready to open, we are going to stop those gift cards where it's you buy for $200, you get a $300 gift card. So $100 off on that one, or you buy a $500 gift card and you can go in Cool Tone. And I should have told Jackie, she can come up and do Cool Tone at the office, because that can give you some amazing butt. Anyway, we'll keep my butt under wraps there. Anyway, but you know, the Cool Tone is normally a $750 for a single. If you're doing a package, just so people realize, it's a reduced price. So that is a really good one, but a free Cool Tone with a $500 gift card. So anyway, you guys, thank you. On Wednesday, I am going to be doing a solo, because looking good feels good. And I am going to talk about threads, because I got a couple texts from some of my patients asking about threads, because there's, you know, a lot of disinformation or fake news out there. And I kind of want to get it straight so people understand. Now, I kind of wanted to talk to Jackie a little bit more about when to go to surgery, but we ended up yapping about other fun things. So maybe we can get her back on. So other things to talk about, if you guys want to direct message some ideas, I'll be happy to talk about anything we do in the office. Stay safe. It is a beautiful day out there, so do go out and walk and get a little bit of exercise if you can. You still need to get out there and move and get that cardiovascular going, because we need to be healthy for our preventing ourselves from getting coronavirus. Anyway, bye, you guys. Love you, and I miss you. I really do want to see you, but it is nice being home and getting some things organized. Anyway, bye.